It's a great day to talk rehab. I'm Dr. Donald DeFabio. And here is my shout out to Dr. Michael from Omaha, Nebraska. First of all, Mike, thanks for reading my article in Dynamic Chiropractic and letting me know you enjoyed it. I appreciate it. I'd written an article recently on chronic neck pain and exercises for chronic neck pain. And Dr. Mike, his question was, what about kyphosis? The article talked about anterior cervical posture, right? Or Yanda's upper cross distortion. He asked about kyphosis. Well, here's what you need to know about kyphosis. Number one, is it a kyphosis? Is it truly rounding of the thoracic spine? Or is it anterior head carriage with an increased thoracic curve? Or is it a true kyphosis? You have to examine them, take some x-rays, number one. Number two, is it tightness of the pecs? Are you just getting rounded shoulders? Because sometimes this happens, wow, it looks like I got kyphosis, doesn't it? But it's this. Pec minor primarily is tight, maybe pec major. If you also notice, where are the hands? When people stand in neutral, you should be able to see the thumbs kind of pointing at you, not the back of the hand. If you're seeing the back of the hand, that tells us that teres major is tight, rotating the shoulders forward. So just because somebody's here, we don't know if it's a true kyphosis or an anterior cervical carrying angle, Yanda's upper cross distortion, or just rounded shoulders. That's where your clinical skills come in. So make that differential diagnosis. Going back to your question, assuming it is a true kyphosis, rounding of the spine, okay, and they're here, it's a true kyphosis, they're not in here, we need to adjust them, adjust that thoracic spine. Old school, move those vertebrae, create compliance in the spine to get them into extension, to get them into neutral. For home care, foam roller works great. Watch my video on how to foam roll the thoracic spine. So you can foam roll for home care. Also for home care, get a TSLO, okay? This is the one I like. It's from Aspen, and I'll show you why it works for me. First of all, there's a little bladder in here that gets pumped up, but you put it on. It locks in your pelvis. So once you lock in your pelvis, then you can get my tie out of the way. This locks in my lumbar spine. Okay, so now my lumbar spine's nice and stable. I pull down from here and it pulls me back. And it really, this is an orthosis. This locks me in. This side needs a little more tension. Where's my rope? There it is. Great. And then over here is my bladder, and it pumps up that little bladder, and I can move that up and down. And now I have a compression fracture at T4. This is right on T4, and it's pushing T4 anterior. Money. But this locks me in. You know, I can't move. So if you want control, a TSLO is the way to go. This is the Aspen TSLO. I love it. So anyway, true kyphosis, Dr. Mike, this is my recommendations. This is how we treat it. Adjustments. And then your exercises, all of your upper cross exercises, all of those same exercises on my posture playlist, the same exercises we talk about in that article on chronic neck pain that's in Dynamic Chiropractic. All of those are still good. And then open up the chest, an orthosis if need be. And there you go. Treating kyphosis works. Let's figure out where the kyphosis is really coming from. Once you have an accurate diagnosis, then you can do your rehab. Hey, look, if you have any other questions, let me know. Thanks for liking, thanks for subscribing, and we'll see you on the next video. I'm Dr. Donald DeFabio.